Hello, my name is Christy Sherrill. As a proud Marine Corps veteran, I would like to welcome you to the Rural Veterans Health Access Program training module for understanding the importance of military culture among healthcare professionals. This video is intended to inform healthcare providers about military culture to give them the tools they need to provide comprehensive treatments and support to veterans who come into their care. This video will explore the complex physical and emotional challenges military personnel face during service and after discharge. All veterans have sacrificed for their country and deserve the highest quality, veteran-specific care we can provide them and their families. In this video, we will explore the following objectives. We will define military culture, identify the importance of understanding military culture when caring for military personnel. We will examine our own attitudes and level of knowledge of military culture, recognize the complexity of psychological, physical, mental, and psychosocial challenges that military personnel experience, and finally, we will provide strategies to become more knowledgeable and competent in treating all military personnel in our health practices. Before trying to understand the uniqueness of military culture, we must begin with a definition of culture itself. Knowledge of the differences is critical when treating military personnel in a comprehensive and respectful manner. In general terms, culture is comprised of the values, behaviors, beliefs, language, priorities, traditions, and hierarchies of a certain population. These elements inform individual and community decisions and daily conduct. Here's a definition of military culture offered in a training module from the Center for Deployment Psychology. Military culture can be defined as the sum total of all knowledge, beliefs, morals, customs, habits, and capabilities acquired by service members and their families through membership in military organizations. This definition certainly reveals the comprehensive nature of military culture. As patients, veterans are sometimes hesitant to discuss service-related experience to both medical and mental health care providers. Veterans hesitate to bring up personal concerns, having been trained to focus on the needs of those in their unit, not their own emotions or health. A common saying among veterans is, "We don't complain about the small things." Most civilians will be surprised to know that not all who serve or have served in the military are called soldiers. Personnel in each branch have distinct ways of being identified. For example, you wouldn't call a Navy service member or veteran a soldier. They would be called a sailor. Marines are not called soldiers. They are referred to at all times as Marines. Providers need to understand that veterans representing all branches are proud of their service and respect the attention to detail concerning this identification. Military culture includes a language and worldview of its own, contrasting greatly from the civilian's view of everyday life. These factors must be considered when treating veterans as patients. Just as you would want to be culturally competent working with any population, with veterans, it is particularly important because they may shut you out or they'll simply walk away if they suspect a lack of understanding. Military culture adheres to a collective mindset. In the civilian culture, the emphasis is individualistic. For example, military personnel see themselves as being part of a cohesive, tight-knit group with the importance lying with the unit's achievement. In civilian life, emphasis and value is placed on individual goals, achievement, and self-reliance. In the military, you are working or on call at all times. As a civilian, you work a set number of hours per week, and personal time is anything outside those hours. Nearly 250,000 service members are discharged from the military each year. With that number of veterans integrating into civilian life, it is likely that healthcare professionals will provide care for a veteran at some point during their professional career. In 2019, the VA released its National Veteran Suicide Prevention Annual Report, which stated that the suicide rate for veterans is 1.5 times higher than the rate of non-veteran adults. The report also stated that veterans consist of over 13% of all deaths by suicide in U.S. adults, but they make up less than 8% of the U.S. adult population. In 2014, Oklahoma had the highest suicide rate among veterans aged 18 to 34 years old. Currently, nearly 22 veterans commit suicide per day nationally. Healthcare systems and providers need to understand the unique and complex components of military culture to work effectively with veterans. An understanding of patient culture can impact initiation of care, perception of symptoms, and perception of treatment options. Patients of providers who were more motivated to learn about cultures within their practice were more satisfied with their visit, perceived their providers were more facilitative, and reported seeking and sharing more information. Understand that some veterans might have lived through several experiences that can lead to the development of one or more of the unseen or invisible wounds of military service, including PTSD, traumatic brain injury, depression, substance or opioid use disorder, and so on. Current studies report that the number of veterans with health care needs is rising. Deployed veterans show higher rates of cardiovascular disease, cancer, chronic pain, and so on. When preparing for a career in any medical field, candidates are required to take several courses to give them the knowledge needed to be responsible healthcare providers. Many colleges of health sciences require courses on cross-cultural competence, believing that cultural competence is an ethical imperative. It is with this in mind that making time to assess our own attitudes, knowledge, and perhaps implicit biases about military practices is a first step before beginning treatment of military personnel. Our attitudes will inform how we approach our patients' medical and mental health care needs from diverse backgrounds and resources. Our veteran patients are no exception. Currently, few medical education and residency programs address the very specific needs of this population of patients. Providers will benefit from recognizing military language, values, and the importance of filling in this gap in medical education. In Oklahoma alone, there are roughly 300,000 veterans, making up around 10% of the population. Of those Oklahoma veterans, nearly 40% live in rural areas. It is essential for healthcare administration to gain the total picture before treatment begins. Here's an example of how the initial question can be phrased to ensure that all veterans self-identify when asked. Have you ever served in the military in any branch, any length of time, anywhere? During the screening process, keep in mind that some veterans may not self-identify. Reasons for not self-identify will be discussed in depth during episode 2. Learning more about the patient's military experiences can inform treatment planning and increase awareness of the extraordinary strengths that veterans often possess, as well as unique challenges that they may face. This will also build a rapport between you and your patient, which will benefit both you and the patient over the course of treatment and beyond. Here are a few examples of questions to ask. Do you have any service-connected disabilities or injuries? Were you deployed to a hostile or combat area? Did you experience enemy fire or witness casualties? Here are a few mistakes that providers make in their practice when engaging veterans. The assumption that veterans in their community are already seeking VA services for service-related conditions. Some providers assume that they can fully understand the patient's experiences, or the provider has not adequately reviewed the patient's history, which may include military service. If a veteran has combat experience, he or she will have experienced a range of traumatic or stressful events. It is important to become familiar with these combat events and the potential reactions to this exposure. Events can include being under life threat, witnessing death and dying, or experiencing the loss of a fellow comrade. These events go beyond physical injury to include what is referred to as moral injury. The nature of loss shapes how the moral pain is experienced and impacts the veteran's everyday life. Moral injury reduces personal vitality and creates a self-perspective of guilt and shame. This also impacts the quality of interpersonal relationships, especially with family and close friends. More on this subject will be discussed in a future training module. Service members who enlist at 18 years old with no prior civilian work experience are catapulted for the first time into a workforce that contrasts greatly from the military worldview. This type of veteran may have never looked for, applied for, or interviewed for a civilian job, especially if he or she had a career in the military. These are new skills the veteran will have to learn and master. For example, When applying for a job, the veteran will have to determine how to translate military skills and duties into civilian terms and create a resume. Reintegration into civilian life after military discharge is difficult for all who have served, requiring many adjustments. For example, establishing services. After discharge, a veteran will have to learn how to search for a doctor, dentist, life insurance, and so on. These types of services are automatically provided to a veteran during military service. Military structure and ranking system are lost upon discharge. The military provides structure and has a clear chain of command. This does not naturally exist outside the military. The veteran will have to create their own structure or adjust to living in a new environment. Everything was mission critical. Now the mission has been discontinued. In the military, personnel do not leave until the mission is complete. In a civilian setting, an employee might be expected to stop and go home at 5 o'clock, whether the mission has been completed or not. This type of work ethic is difficult for veterans to adapt to and takes time. Veterans go from training and working as a unit during service to working individually in a civilian setting. Here are some tips to make your facility veteran-friendly by including the following in your practice. Use VA resources that are available to non-VA healthcare professionals and facilities. Create veteran-related partnerships in your practice, and connect with your community. Veteran families in the community have specific gaps and needs as well. Throughout this training, we have addressed key factors that can positively impact your organization when meeting the needs of the veteran population. Here they are summarized. Begin by assessing your current attitudes and knowledge of the military worldview. Screen your patients for military history. Participate in veteran-specific trainings. Treat the whole person to improve the provider-veteran relationship, which leads to enhanced health outcomes. And express your appreciation for their service. Instead of saying, "Thank you for your service," personalize the way you express your gratitude. For example, "I see from your intake form you were in the Army. Thank you for your commitment and sacrifice. What was your job in the Army?" This is the conclusion of our first video in the RVAP series. Future modules will include screening patients for military history, moral injury, veterans in addiction medicine, and more. On behalf of the RVAP team, I would like to thank you for your dedication to the veteran population by participating in this training module. If you have additional questions, please feel free to reach out to the email shown here.